everybody, welcome to this week's Tips and Tricks where we talk about how to stay balanced. And this week we are going to look at a very interesting use for eye tracking. So if you watched some of my other videos, we have talked about eye tracking, but did you know that eye tracking can help reduce pain and can help down-regulate the amygdala? So the amygdala, when we are in anxiety, panic attacks, or even maybe children, you're having meltdowns, that is, the amygdala is, and the limbic system is basically on fire and kind of out of control. Well, the way that we can control that is by upregulating the frontal cortex. And the frontal cortex, when we upregulate that, it seems to have an inverse relationship with the amygdala. So we upregulate the frontal cortex and the amygdala can come down. Also, it can, because we're upregulating that frontal cortex, we can also be lowering pain, by the way. So if you're experiencing a headache or any kind of pain, you might want to try this. So there's different ways that you can do eye tracking, and if you've seen my other video, there's smooth pursuit where you're literally tracking the object back and forth, or you have two objects and you're going back from one to the other. Those are saccades. This is smooth pursuit. There is a little bit of a difference, but your eyeballs only need to be moving, not your head, okay? So if you see me, by the way, in this video moving my head, it means I need to do a little bit of work on it. But what we're going to do is we're going to make the big H. We're going to go back and forth. A few times, and then we'll go up. And we'll go over. We'll go up. Okay, we can also do circles, and we can also do crosses. Okay, and also somebody just mentioned the other day that he works with folks that have Parkinson, and he said that if they do eye tracking or go back and forth or do some eye tracking and then do some tracking where they're looking at their finger and they're coming to touch their nose, if they do that for a couple minutes, their tremors go away. So I'm not saying it works for everybody, but for certain people, their tremors might have a different onset with from one to another, and that is a way that they're able to even reduce their tremors.